If you're watching this, chances are you've been recommended for a colectomy, a surgery to remove all or part of your large intestine, also called colon or large bowel, which is an important part of your digestive system. At this point, you may have some questions, so we'd like to take a couple of minutes to help you understand: why is a colectomy performed? How is it performed? What are the different types of surgery? What are the options? What are possible side effects and complications? And finally, what do you need to do to prepare for this procedure? There are a number of reasons your doctor may recommend that your large intestine be removed. Most commonly, removal of all or part of your intestines is necessary because of cancerous or precancerous lesions, a blockage, inflammatory bowel disease, or diverticulitis, inflammation of a pouch called a diverticulum, which forms in the wall of the large intestine. Less commonly, removal of all or part of your intestines might be needed for other conditions, such as familial adenomatous polyposis, also called FAP, which is a genetic disorder of the large intestines that leads to the formation of many polyps, and which will often lead to cancer if untreated. Sometimes a person who is involved in a traumatic injury may require removal of all or part of the intestines. There are many disorders of the large intestine, and they are caused by a variety of conditions. They often have similar signs and symptoms. Thus, it's important for you to have a thorough medical evaluation before considering surgery. The decision to recommend removal of all or part of your intestines is usually based on a complete medical evaluation. This usually consists of a review of your medical history, a thorough physical examination, and any tests, such as blood work or imaging, that your doctor decides are relevant. Any decision about surgery should weigh the risks and benefits and should only be made after you and your family discuss all of your treatment options with your doctor. For conditions such as cancer, removal of all or part of your intestines may be necessary, and surgery may be one of many important parts of your treatment. While most surgeries to remove all or part of the intestines are performed with traditional surgery, also called open surgery, abdominal surgery, or laparotomy, laparoscopic surgery, a less invasive approach, is becoming increasingly more common. Both open and laparoscopic procedures require general anesthesia, which means that you'll be unconscious during the operation. In open surgery, one relatively large 8 to 12-inch incision is made in your abdomen so that your large intestine can be located and removed. In laparoscopic surgery, 3 to 5 small half-inch or less incisions are made. Depending on which part of the colon is involved, a laparoscopic colectomy can be performed on the left or right side. In rare occasions, the whole colon must be removed. Our laparoscopic drawings will focus on the left side. One of these tiny incisions is placed around your navel, or belly button, where a video camera called a laparoscope is inserted. The video is projected onto a monitor, which allows your surgeon to see inside your abdomen while performing the procedure. During the procedure, your abdomen will be expanded by gentle inflation with carbon dioxide, so the organs, intestines, and blood vessels can easily be seen. After the video camera is inserted, other tiny incisions are made in your abdomen, and thin instruments are inserted for your surgeon to use to perform the procedure. In some cases, your surgeon will need to make another larger incision to remove the colon from the abdominal cavity. For open or laparoscopic surgery, your surgeon will connect the two ends back together if there is enough healthy large intestine remaining, which is usually the case. If there is not enough healthy tissue remaining, your surgeon may have to perform a colostomy. A colostomy is a surgical procedure where the upper end of the large intestine is sewn to an opening created in your abdomen. A bag is attached to the opening on the outside to collect waste from the large intestine. The colostomy is usually temporary, but may be permanent in special cases. Talk with your surgeon to discuss your situation and whether you may need a colostomy. Laparoscopic surgery to remove all or part of your intestines should be performed by a surgeon who has special training and experience using this technique. Laparoscopic surgery has been performed for over 20 years. but has only been accepted for the treatment of colon disease since 2000. Several improvements have been made over the years, including safer instruments and high-definition cameras, which allow for enhanced vision. Today, laparoscopic surgery offers several benefits over open surgery. The short-term benefits of laparoscopic surgery over open surgery include smaller incisions, thus reduced scarring, and there is no need to cut the muscles of the abdomen. For this and other reasons, the healing time is often faster, meaning you may be able to leave the hospital and return to normal routines and activities sooner. In addition to improved healing time, many patients report less pain after laparoscopic surgery, which results in fewer pain medications and lessens the risk of infection. Also, the bowel habits and diet of patients following laparoscopic surgery often return to normal sooner than those having open surgery. Depending on various factors, laparoscopic surgery may not always be the right approach for large intestine surgery. There are some variations in the way surgeons do this technique with similar results. Talk with your doctor to see if laparoscopic surgery is right for you. For the vast majority of patients, a laparoscopic approach is possible. However, some people are not good candidates for laparoscopic surgery due to previous abdominal surgeries, the size and involvement of the surgery, other medical conditions you might have, and other reasons determined by your surgeon. When you meet with your surgeon, he or she will consider various factors when determining which route is best for you. In an emergency, the severity of your condition may require a traditional open surgery approach. As with any major surgery, there are risks involved with surgical removal of all or part of your intestines. Sometimes other tissues have to be removed from your abdomen based on what your surgeon finds. Although rare, bleeding, problems with anesthesia, unintended injury of other organs or blood vessels, and the development of blood clots can occur. Very rarely, death following both types of surgery has been reported. Side effects of surgery to remove all or part of your intestines include pain, abdominal bloating, and nausea and vomiting. Complications may include infections, a breakdown of the connection of the two pieces of colon resulting in a leak and internal scarring called adhesions, or injury to the ureter, the tube connecting the kidney to the bladder, that may require another surgery. Your surgeon may be unable to complete the surgery laparoscopically. In such cases, there may be a conversion to an open procedure. As with any surgery, it's important to follow your doctor's recommendations closely on the days leading up to and after your surgery to reduce the risk of complications. Talk with your doctor to make sure you understand your options, discuss possible side effects and complications, determine which type of surgery is right for you, understand what will happen during surgery, and know what you need to do before and after surgery to help ensure the best possible result.